Dr. Hazel, the Chief Medical Officer within the Ministry of Health. We are in the middle of the influenza or flu season, which occurs anywhere from November of each year to March of the following year. Influenza or the flu is an acute and very contagious respiratory tract infection caused by the influenza types A and B viruses, which are circulating in our federation, in the region, and all parts of the world. The influenza virus causes mild to very severe illness and at times can even lead to death. The flu usually comes on suddenly within 1 to 4 days after becoming infected. Persons who have the flu often experience some or all of the following symptoms, and these include fever, sore throat, coughing, stuffy or runny nose, muscle and joint pains or body aches. Some patients complain of headache and sometimes even dizziness, chills. There's often loss of taste sensation and loss of appetite, malaise and fatigue. Some patients complain of diarrhea and vomiting. Most persons recover from these flu symptoms within 1 week. However, some persons are at high risk of progressing and developing complications of the flu, like ear infection, sinus infection, severe infection of the lungs or pneumonia, and even worsening of underlying chronic medical conditions such as asthma, heart disease, and diabetes, which can be fatal. So the big question is, how can you prevent getting the flu? Well, here are 7 tips to help you prevent the flu. 1. Stay away from anyone who is coughing or sneezing. So maintain some distance from anyone who is coughing or sneezing, because the virus is spread via the tiny droplets of respiratory secretions from infected persons who cough and sneeze. Keep your hands away from your face and far away from your mouth and nose. You can easily get sick if you touch an infected surface and transfer the virus to your nose or mouth. Clean and disinfect communal surfaces at least once per day. For example, make sure to clean doorknobs in the home, in the school setting, and the workplace, because the virus can remain viable without a host for about 24 hours. 4. Wash your hands properly after touching any commonly touched surfaces, such as door handles, water coolers, communal keyboards, and even light switches. 5. If you are ill with the flu, you should remain at home from school and work. I repeat, if you are ill with the flu, you should remain at home from school and work. Make sure to see your regular physician and ascertain an official sick leave certificate. Number 6, keep well hydrated and get enough sleep and rest for optimal functioning of your immune system. Number 7, get the flu vaccine. Persons who are 65 years and older with chronic conditions like asthma, pregnant females, and frontline health workers, you can get the flu vaccine at any health center in St. Kitts and in Nevis. The flu vaccine helps to prevent the serious complications of the flu and has been available in the Federation since the 2017-2018 flu season. The flu can be dangerous in children under 5 years, in persons over 65 years, in pregnant women, and in persons with chronic conditions like asthma and diabetes. I recommend that you visit your regular doctor or the district medical officer at the nearest health center if you develop any symptoms of the flu. The flu virus can adversely affect older persons and can lead to life-threatening complications. Be proactive in strengthening your immune system and take preventive steps to avoid getting the flu. I take this opportunity to wish everyone optimal health, happiness, and success for 2020 and beyond. Thank you.